The ranking member, Ms. DeLauro.
Thank you very much, Mr. Chairman. Let me just one area of correction, which has to do with the measles issue, Mr. Secretary. You keep comparing the U.S. to other countries. You compare us to Europe, but the Europe you are referring to is the WHO European region. That's 53 countries in Europe and in Asia, including those with low vaccination rates like Romania, that has never eliminated measles. If you compare us to Western Europe countries that we often compare ourselves to, like Great Britain, they have seen no measles death this year. Let me move to the NIH. In your testimony, you say you want to quote, and I quote, rescale our biomedical research budget, unquote. Excuse me, but that's BS. You are not rescaling NIH research. You are proposing to cut it by $20 billion. And according to our colleagues in the Senate, NIH has effectively cut research funding by $2.7 billion this year in comparison to the same period last year. That's a cut of 35% during that period. That includes cutting cancer research by 31%. This is the report put out by the Senate, Trump's War on Science, which goes into detail about how we are, in fact, dealing with cutting scientific research. Mr. Secretary, are you freezing or withholding funding that Congress appropriated in 2025 for life-saving NIH research?
Ladies and gentlemen, patriots of this great nation, welcome back to the channel where we stand for truth, for liberty, and for the Constitution of the United States. Today, we are reacting to a fiery exchange between Congresswoman Rosa DeLauro and Health and Human Services Secretary Robert F. Kennedy Jr., yes, RFK Jr. in a congressional hearing where DeLauro goes off the rails over measles outbreaks, NIH funding, and the CDC's tobacco prevention programs. Let's break this down, because there is so much here that the mainstream media won't tell you. And I've got some thoughts as a conservative, as a patriot, and as someone who is sick and tired of the federal government trying to play scientist, doctor, and moral compass all at once. Right out the gate, DeLauro tries to school RFK Jr. on measles outbreaks. She's upset that he's comparing the U.S. to the WHO's European region, which includes Eastern European nations like Romania. She insists we should only compare ourselves to Western Europe, like the UK. But here's the thing: RFK Jr. brings real data to the table. Mexico and Canada have more cases relative to their populations. Western Europe has 10 times the cases.
Let me address your first issue first, because I want to correct you. We have about 1,100 measles cases in this country. The growth rate last year was 15 additional, so we have plateaued. Mexico has roughly the same number with a third of our population, and they got 300 extra quick cases last week. Canada has more measles, 1,500. They have 1/8 of our population. Western Europe has about 6,000, which is 10 times the number that we have. Well, you are wrong about what you said earlier.
We can discuss that, but I think one has to consider whether or not we're dealing with decades of data proving how effective and safe the measles vaccine is. I want to move to that. I want my questions answered on, are you freezing and withholding funding that Congress appropriated in 2025 for life-saving NIH research?
We are not withholding any funding for life-saving research.
Okay. Do you commit to following the law?
Of course.
Fully obligating funding that Congress appropriated. We appropriated, it is the law of the land for NIH research, and to obligate those funds by September 30th of this year. Or are you planning to break the law by impounding congressionally appropriated funds?
If you appropriate me the funds, I'm going to spend them.
We have. In the bill, you are cutting the NIH by $18 billion, or you're proposing to cut it by $20 billion. The Congress appropriated those funds. It passed into law. It's part of the 2024 budget, and we are under a continuing resolution that has adopted the 2024 numbers. How then can you justify cutting $20 billion from the biomedical research budget?
If you appropriate the money to me, I'm going to spend that.
We have appropriated, Mr. Secretary.
Then I'm going to spend it.
Then you're going to spend it. You're not going to cut $20 billion from the NIH.
The White House proposal is to do very, very large cuts at NIH.
Well, that is contrary to the money appropriated.
Ranking member.
Yes.
If Congress appropriates me the money, I'm going to spend the money. You have the power of the purse here.
Thank
sure
you.
know that.
Thank you for reiterating that, but I think that I'm not sure the administration really has internalized that, particularly Mr. Vogt hasn't internalized that when he says that we can in fact, impound money. The money is there. The 2024 budget includes the funding for the NIH. Will you commit to spending the money that is in 2024 in that budget?
As I said, Ranking Member, if you appropriate the money, I'm going to spend that money.
The money has been appropriated. So the answer to that is if you're not willing to accept the funds that have been lawfully voted by members of the House and Senate on the money for the National Institutes of Health. Well, I'm going to hold you to your word that that funding is there. It should be transferred from 24 to 25, and you've cut already $20 billion. Let's get that money back. Let's get that money back. You have an obligation to carry out the law and to implement what the Congress has done. Unbelievable. Unbelievable. Chronic disease and tobacco. Tobacco use is a major contributor to chronic disease and is a leading preventable cause of death in our nation. Each year, killing nearly 500,000 Americans, costing the nation nearly $250 billion in healthcare costs. CDC's tips from former smokers media campaign alone is estimated to have saved more than $7 billion in healthcare costs by helping more than 1 million smokers quit. Why did you eliminate CDC's Office of Smoking and Health, an office that reduces the number of kids using tobacco products, helps order tobacco users to quit, and saves taxpayers dollars?
We have, under the reorganization, and I'm going to talk very, very broadly, because as of 4 o'clock yesterday afternoon, we are under a court order not to do any further planning on the reorganization. And I've been advised by my attorneys and not to talk about it. But I will just say broadly, many of the programs that the Democrats are now saying were cut at CDC were not cut at all. Those programs were transferred to the Administration for Healthy America. But I'm not permitted to talk in any more detail because of a court order.
I know we're just dealing with words. You transfer it here, there's less money overall for the agency, therefore there's less money for the programs. In both 2024, 2025, Congress, again, power of the purse resides here, appropriated $246 million for CDC's tobacco prevention programs. Do you commit to following the law again, fully obligating those funds so that we can help adults who want to quit using tobacco and prevent teens from becoming addicted?
Allow me to answer that by pointing out the absolute cataclysmic disorganization of this agency under your oversight for 40 years. We had 9 separate offices of women's health. When we consolidate them, the Democrats say we're eliminating them. We're not. We're still appropriating the $3.7 billion, but we're not keeping all 9. We had 8 separate offices for minority health. We eliminated 1. We had 27 HIV offices.
Okay, let me just, I'm going to
We had 59 behavioral health
right.
programs.
I'm well over time. If you could just get us what has been eliminated, why you're doing it, and the criteria by which the elimination has occurred. That is information that this committee needs in order to be able to do our job in terms of appropriating funds. Thank you.
And we will gladly provide that to you, but right now we're under a court order that prohibits us from doing so.
Okay.
So who's being misleading here? DeLauro is cherry-picking her comparisons to paint the U.S. in a worse light, when in fact our numbers are stable. It's classic liberal hysteria. Weaponized statistics to expand government control. Now this is where it gets absurd. DeLauro flips her lid over what she calls a $20 billion cut to NIH biomedical research. She calls it BS Real Professional. Huh? Here's the truth. We're not cutting vital research, we're cutting the bloat under the Trump administration. And now with conservatives pushing back, we're finally seeing someone like RFK Jr. saying, asterisk, if Congress gives me the money, I'll spend it. But I'm not funding waste. And that's what this is about, folks. The NIH has become a bloated, unaccountable beast that pours millions into nonsense studies and DI bureaucracies. You want to find out why transgender crickets are depressed in Bolivia? NIH probably has a grant for that. This part right here, it's political theater. DeLauro accuses RFK Jr. of breaking the law by withholding funds. But RFK Jr. calmly states again and again that if Congress appropriates the funds, he'll spend them, period. But DeLauro doesn't want answers. She wants sound bites. She wants to paint RFK Jr., a Democrat, by the way, as some villain who doesn't care about cancer or science. The truth? RFK Jr. is saying we need accountability. That's what conservatives have been saying for decades. Here comes another overreaction, this time over the CDC's Office of Smoking and Health. DeLauro claims the office was eliminated. RFK Jr. says it was reorganized, not cut, and there's a court order preventing him from saying more. Let me ask you, since when did consolidating departments become a bad thing? Under the Obama and Biden administrations, we saw duplicative offices wasting billions. 9 offices for women's health, 27 for HIV, 59 for behavioral health. That's bureaucratic madness. We need lean, efficient government, not alphabet soup agencies duplicating each other's jobs. That's how you drain the swamp. Friends, this whole exchange shows you exactly how out of touch the progressive wing of this country has become. They scream science while refusing to admit that the federal government is wasting your tax dollars in the name of research. They claim to love democracy, but hate it when Congress doesn't rubber stamp their bloated wish lists. Rosa DeLauro isn't defending the American people. She's defending big government. And RFK Jr., who isn't even a Republican, is finally calling out the reckless spending, bloated bureaucracy, and political manipulation in public health. And for that, he's the enemy? No, he's doing the job that more Republicans should be doing. Standing up to the radical left and telling them, you don't own the truth, and you don't own the power. We need more voices like RFK Jr., willing to stand in the fire and not back down. We need fewer career politicians like Rosa DeLauro, who've been in D.C. so long they think every dollar belongs to them. If you're tired of waste, if you want your tax dollars spent wisely, if you believe America needs a return to limited government and accountability, then share this video, hit that like button, and subscribe for more unapologetic truth. This is your country. The Constitution gives you the power, not unelected bureaucrats, not lifetime politicians. Let's take it back. God bless you. God bless our troops. And God bless the United States of America.